World War C is what the corona outbreak is looking like. As countries afflicted by the latest strain of the virus Covid-19 go beyond 110, the WHO announces the situation a pandemic. For Iran, it is yet more. It's not just a war, but a criminal war. Still, the country is strategizing just to track and tackle the biological agents wreaking havoc. This is while it should be celebrating the Persian New Year season, which is the month of March. Iran can control the corona outbreak in a month, said the WHO's Richard Brennan in early March. Now that sounds pretty advanced, but in the same breath he said Iran must change its strategy. So what was wrong and what has Iran achieved, even pioneered? There are limitations. This country has been under siege for the past couple of years, and now some say it is being a victim of bioterrorism. I'm Leila Faromarzi and you're watching Iran Today. The total number of infected cases is 14,991 out of over 183,062 worldwide. Over 853 is the number of total deaths in Iran, and those recovered are 4,996 as of Tuesday, March the 17th. There have been doctors who put their knowledge of medicine to the best use possible rather than wait for a cure. As for the dream cure, a vaccine, opinions differ. I asked for a comparison of Iran's anti-corona action to that of other countries. Tehran municipality has a lot of input for our show today. I got to talk to the spokesman, Mr. Mohammadi. Do tell of the municipality's responsibilities in this fight against corona.
At the Tehran municipality, on a daily basis, 20,000 workers are providing urban services, disinfection services, healthcare services, food supply service, and protecting anti-coronavirus groups. These 20,000 persons are well trained. Alongside them are 15,000 other municipality staff who are well trained and are ready to intervene if need be. At around 22 warm houses in the city, we are sheltering nearly 4,000 rough sleepers who emerged during the peak of the cold season. Such big numbers at this period of the year is often unexpected, but we are looking after them. They're often vulnerable to illness, and experience has shown that if they're infected with any virus, it could be harmful. We're now welcoming them and taking care of them. We're supplying basic necessities throughout 250 chain stores. No store has reported any shortage of stocks in the city. The stores are now open round the clock. Some others have increased their working hours. What we saw in the US and Europe, where people rushed to stores, was not seen in Iran. That's an undeniable fact. Why? It's because we have supplied sufficient commodities. We purchased 3,000 billion rial worth of commodities in advance for the chain stores recently.
Now a national mobilization force has been formed in the country. At the governmental level, we have the National Committee for Coronavirus Prevention and Management. Headed by the Minister of Health, this committee comprises relevant ministers who head different subcommittees. At the next level, we have the Coronavirus Combat Committee affiliated with the Ministry of Health. This last committee was active before even coronavirus cases were identified. It's now continuing its work. We have now established a national mobilization force for fighting coronavirus in the form of a national campaign whose slogan is "We'll defeat coronavirus." This hashtag has gone viral and been widely trended on social media.
Iran has been faulted for, like Italy, remaining in disbelief and denial of the virus. But international observers appear pleased at action taken since the lethal virus was given full recognition due. According to the WHO, sanctions are no match for Iran's will to combat corona.
I think we all agree that the priorities of the government in scaling up the response for controlling coronavirus are appropriate. There are many strong elements of the response that we can already see. We really do congratulate and thank the Ministry of Health and particularly the frontline health workers for the tremendous work that we're seeing being done. There's a lot more work to be done, but overall we think good progress has been made in a short period of time.
To curtail the spread of the virus, the Iranian government has been able to act in a short time in educating the public, providing hygienic necessities and masks where urgent, disseminating accurate and timely information, quarantining high-risk cities, and dedicating specialized hospitals to corona. Moreover, schools and universities have been closed until the end of Nowruz, the Persian New Year celebrations early April. Mosques have been disinfected and cultural events have been cancelled. And 15 provinces of 31 have travel restrictions imposed on them. Iran even released an official coronavirus app, but Google pulled it from its Play Store. Iran's Android app is intended to self-diagnose rather than go to a hospital. There's a lot more one can do, and this country has mobilized the whole force to combat the coronavirus. On the whole, how do you assess Iran's activities in combating the coronavirus?
We had a meeting with the WHO representatives in Iran, as well as World Health Organization delegations who visited the country. Those WHO delegates acknowledged that we had done serious work. They said that they had rarely seen such activities elsewhere. They were especially grateful to Iran for its initiatives and rapid action. For example, they said the decision to cancel weekly Friday prayers, as well as collective prayers at mosques in a Muslim state, set a good example for fellow Muslim nations to follow. They were surprised at the increased number of laboratories for detection and screening. They also appreciated the widespread activities carried out across the city of Tehran at such a high pace. They believe that Iran's actions conform with the protocols recognized by the World Health Organization.
The IRGC has formed a special task force for the fight on the virus, which either mutated in nature or was engineered by the US for the Chinese economy and the Iranian population. This is a theory based on arguments such as, in Europe, Italy has been hit hard by the virus, as Iran has been hit hard in Asia and ranks third in the world. Now, Italians are genetically very similar to Iranians, and so the spread of COVID-19 among Italians means the US may well have made an ethnic weapon, a virus whose genome has been designed to stick more to certain genetic receptors, that is, of the Iranian type. Now it is to be seen if the suspected mutation of this mutant, that is the harsher, now airborne strain of the virus, will also spread faster among these two nations. US President Trump's indifference was as if he thought the virus were for others, not Americans. He reportedly ignored early warnings of the severity of the virus, and when a CDC official warned him in February of an inevitable outbreak, his administration just dismantled the National Security Council's Global Health Office, whose purpose was to address global pandemics. The leader, who is commander of all forces, Ayatollah Khamenei, issued a command to the Chief of Staff, General Bagheri. The order went as such: it is imperative that all corona combating services of the armed forces be brought under the umbrella of a single health and treatment base. In addition to setting up health centers like field hospitals and recovery units, the effort must include methods needed to prevent the further spread of the disease. The base, which is to act in full coordination with the government and Ministry of Health, must divide and assign the duties specific to each of the armed forces units. The effort might even increase the nation's might as a biological defense maneuver, because looking at evidence, there is the possibility the incident is a biological attack.
Is it theory or truth that the US manufactured this strain of the coronavirus to attack the Chinese economy and the Iranian race?
Yes, the possibility is high. China has officially said it might have been biological warfare. The leader of the Islamic Revolution, also in his message to Major General Mohammad Bagheri, the Chief of Staff of Iran's armed forces, noted that it might have been biological warfare, and therefore the armed forces General Staff had to intervene. Our impression is that in the light of the current empathy in the country, we would cross this stage. We will be harmed, but we will survive, I'm sure. I'm pretty sure that such empathy and solidarity would give rise to a new social asset for us. Coincidentally, for a country like ours, such threats are opportunities.
The IRGC, which has in past, together with medical professionals, conducted polio and other immunization drives and responded to earthquakes, has an estimated 125,000 plus troops and 600,000 mission-ready volunteers. Using modular construction, the force quickly built hospitals and created a headquarters called the Coronavirus Combat Base. This is staffed with modern warfare units that focus on how to respond to chemical, biological and cyber attacks. That base or headquarters is working with organizations and bodies relevant to enhancing public awareness, such as the Culture Ministry.
Currently, apart from our security staff, our technical and logistical staff and other departments are busy with detection services. We have the flu ward, the molecular virology ward, and the epidemiology ward. They have suspended all of their work in order to help with the coronavirus diagnosis. Other sections are also helping them. Many of our students have voluntarily come to help. Our colleagues from Pasteur Institute have come to help us. We have currently at least 30 professional persons at each shift at the laboratory.
More than 70% of residents of Tehran have seen their life affected financially by the coronavirus. We have to compensate for the damage inflicted upon them, but the municipality just cannot afford it. The government has to come and help us. If we want to ask someone not to show up, we have to pay him a sum of money so that he'll be reassured. We've not done enough with regard to people's psychological health. We have to deal with this issue seriously in partnership with the Psychiatry Association and our prominent psychologists.
The government allotted over $100 million, that's 16,000 billion rials, to the Corona Combat Task Force and Iran Medical Sciences universities. Also, smaller handouts and loans were respectively designated to 3 million nationals with no incomes and 4 million damaged employees.
Every day, with 200 teams, we disinfect 180 spots in the city. Our firefighters are doing so with their own resources. We also disinfect 60,000 taxis, both directly and indirectly in Tehran, with the assistance of riding applications. We also disinfect about 5,000 buses, 3 to 4 times a day. There are also 1,500 wagons that are disinfected twice a day.
If you know the basics, you know that SARS, MERS and Covid-19 have already caused such turbulences. We are likely to experience new viruses in coming years, as such viruses proliferate in various hosts. And when several viruses proliferate in a single host, they are likely to give rise to a new virus that could be transmitted from human to human. The coronavirus is estimated to have been originated from bats, before being produced in a pangolin.
Time for a short break. We'll be back in no time. China, where it all appears to have begun, has, with a tight regime of quarantining and controlling people's mobility, kept the spread in check. While throughout the rest of the world at large, the contagion has spread like wildfire. COVID-19 may inflict a death rate of only about 2%. But the speed of its contagion has bewildered medical professionals. The WHO says Iran's response to the virus has so far been up to speed. Still, it says the US sanctions are a big challenge, and Washington would be complicit in the rising death toll in Iran if it did not remove its sanctions.
I think because the Iranian system is switching on, we're seeing a much more all-of-government approach, as the DG called for yesterday. There's a national action plan now. There's 100,000 workers committed to this plan, and we are going to see any country in the face of an epidemic, when it looks for cases, will find them. And if we call that a bad thing, it is. It's a sad thing for the people who have the disease. But it's much better that we understand the extent of the problem.
It's a struggle even for the most advanced countries. As well as Iran may be fending for itself, it is under economic and now medical siege by the US, and international help is welcome. Iran's central bank chief Hemmati did write to the IMF, requesting $5 billion in emergency funding from its rapid financing instrument. On March the 4th, the Washington-based body's managing director, Kristalina Georgieva, had announced a $50 billion aid package for low-income countries. On March the 12th, the Iranian foreign minister wrote to the UN, demanding an immediate removal of US sanctions on his country. Here's a look at the items sent to Iran by the World Health Organization, WHO, and some other institutions and countries. The WHO provided medical supplies and equipment to Iran, including hundreds of thousands of gloves, surgical masks, and related materials that will help about 15,000 people and healthcare workers in Iran. It also included laboratory diagnostic tools to test thousands of people, to then isolate and attempt to cure them.
We have a lot more work to do, and I can commit that the World Health Organization will provide all the support we can to the government of Iran to defeat this virus, and we are very optimistic that together we will make excellent progress.
In an impressive move, the E3, that's France, Germany and the United Kingdom, expressed their commitment to supporting global efforts to combat the spread of COVID-19. In doing so, they offered Iran a comprehensive package of both material and financial support. Europe's move appears all the more impressive next to its ally, America. But more on that after a quick media review. For that, I give you Shahrzad.
Hi, I'm Shahrzad Manucheri, and this is the news section of Iran Today. We'll be looking online for the latest update on the COVID-19 outbreak, Iran's actions and approaches. In an article by New York Times, we look into how the world's largest coronavirus outbreaks are growing. Milan, Italy. Daegu, South Korea. Qom, Iran. Many of the world's largest coronavirus outbreaks took root in and around well-traveled cities, but they have since grown to encompass entire countries. Cases have spread across Italy's north and down to Rome, leading to a lockdown of the entire country. Iran's capital has seen thousands infected, and cases continue to surge across Europe. Official case totals are an imperfect method of judging the world's outbreaks. Every country has more cases than it has been able to detect through lab tests. And a shortage of testing kits in some countries, like Indonesia and the United States, along with a lack of public disclosure in others, like Egypt, means official reports are probably masking larger outbreaks. Mer News reports Iran doesn't need U.S. help with corona, says Nasrallah. Secretary General of the Lebanese Hezbollah resistance movement, Hassan Nasrallah, said that Iran does not need the U.S. help in the fight against coronavirus outbreak. He said that the outbreak of coronavirus is now the #1 priority of the world, and the Middle East is not the only region dealing with it. Hailing Iran's efforts in the fight against coronavirus, Nasrallah also criticized the approach of some Arab media of the Persian Gulf towards Iran and its fight against the coronavirus, and said, "The Iranians are in the front line of the battle, and many of them have been infected during the battle." Common Dreams claims in order to help stem the coronavirus, we must lift sanctions on Iran. Among those in Iran who have been unable to get critical medications have been patients with leukemia, epidermolysis bullosa, epilepsy, and chronic eye injuries from exposure to chemical weapons during the Iran-Iraq War. Now coronavirus is added to that list. The reimposition of sanctions after the Trump administration's withdrawal from the nuclear deal in 2018 has had a devastating impact on the economy and on the lives of ordinary Iranians. Even before Iran was unable to procure enough testing kits, respiratory machines, antiviral medicines, and other supplies to slow the spread of the coronavirus and save lives, Iranians were having a hard time getting access to life-saving medications. In October 2019, Human Rights Watch released a report citing that the overbroad and burdensome nature of the U.S. sanctions on Iran has led banks and companies around the world to pull back from humanitarian trade with Iran, leaving Iranians who have rare or complicated diseases unable to get the medicine and treatment they require. That's all for this segment. We'll see you next week.
I said earlier the COVID-19 outbreak was to Iran more than combating a coronavirus. Iran is both fighting this biological war and is also striving to survive the economic and now medical siege the US has laid upon it. US sanctions renewed in 2018 didn't officially ban the entry of essential goods into Iran. If Iran couldn't readily import medicine, it was thanks to banking and secondary sanctions, as these would make it difficult to pay other countries for medicine.
The sanctions have had harmful effects, and the international community's responsibility would be put to a test. The fact is that we're fighting discrimination in the healthcare sector. In Iran, we seriously need healthcare equipment, which we have to supply domestically, but without sanctions, so many factories in the world would have multiplied their output, but now we have multiplied our production. It would have been much easier for us to import such equipment. This is the same with medical equipment, pharmaceuticals, diagnosis kits, screening, labs, PPE, and even disinfectants. We had to manufacture two heavy apparatus in order to disinfect the city of Tehran. As our friends at the Foreign Ministry say, it's Corona 2+, because we're fighting both coronaviruses and the sanctions.
But now, going by global research, an anti-Iran pressure group with close ties to the Trump administration is openly urging major pharmaceutical companies to end their Iran business. Actually, they're blackmailing those companies into doing so by naming and shaming, therefore impacting the cost-benefit of deals with Iran. Foreign Minister Zarif called it medical terrorism. The world can no longer be silent as US economic terrorism is supplanted by its medical terrorism, he tweeted. Europe itself is at the suffering end. To give example, thus far, if Iran's Deputy Health Minister Harirchi got infected, so did the UK's Health Minister Dorries. And as some 8% of Iranian parliament are said to be infected, so the UK parliament is also susceptible, with MPs sitting shoulder to shoulder in the House. And so there are calls to send Parliament into recess, as in Iran, Majlis is already indefinitely suspended, and politicians are banned from traveling to and fro. I asked where Iran was with diagnostic kits. Had it developed or naturalized any for itself? They were taken by surprise, but they took the surprise by its horns. Iranian doctors wasted no time in making their own in-house concoctions for their patients, and they were pleased with the results. Plenty of corona-inflicted patients were cured right from the start of the virus's uncalled-for visit. But every cure begins with diagnosis. Here at Pasteur Institute are some of the frontliners in exactly that diagnosis.
The Rapid Reaction Team from Pasteur Institute was established in 2009. If I'm not wrong, it is tasked with identifying an unknown infectious disease very rapidly and deal with the spread of novel diseases. We conducted necessary consultations. We set up our own team. We analyzed the latest detection methods provided by international bodies, and then we prepared a vendor list. But as you know, sanctions pose a serious challenge to us. We cannot receive diagnosis kits as fast as other countries in the world. However, we are trying our best to offer the best possible services in the country. We have the experience of the time of spread of MERS, which had originated in Saudi Arabia. We had developed a method which could help identify most coronaviruses. We received samples at Pasteur Institute, and we updated our detection methods. We currently have our own special method of diagnosis. Thanks to WHO and Iran's Health Ministry, we have reached the capacity of 1,000 tests a day.
Deputy Health Minister Raisi said that Iran hoped to produce the corona vaccine and drug in up to a year. However, in bringing up the matter of innovation, virologists, although confident in their capability, say Iran will have to update its lab equipment before it can produce a vaccine. The US, for all its wealth and medical know-how, is in an embarrassing situation. President Trump has veered from unfounded optimism about the virus having afflicted America to attacking his foes. A vaccine is inevitable. It's now to be seen which of the virus's many victims will first come up with an antidote, and how many types of the virus will emerge to get into the concoction, which is a vaccine. Thanks for watching. Bye for now.